big hand in the board.
All right. All right, do we have our, let me just put our... Good morning, everyone.
Good morning.
Thank you for being here today. So my name is Saira Draper, and I'm the state representative for House District 90 in Atlanta and DeKalb County. And I feel very privileged to represent a district that is the home to many federal workers, civil servants who are committed to the public interest. And among the many civil servants in Georgia, more than 10,000 work for the Centers for Disease Control and Prevention, the agency charged with protecting Americans from outbreaks and other public health threats. Some of the most brilliant doctors and scientists in the world. We are here today because the so-called Department of Government Efficiency is firing federal workers indiscriminately. They are gutting programs without considering their impact. Make no bones about it, the way this is taking place is unnecessarily cruel, unnecessarily chaotic, and unnecessarily reckless. Reject the notion that the tactics used by DOGE are about efficiency or about simply trimming the fat. Though that is in line with the line that the public is being sold, the facts show otherwise. There is nothing efficient about sending critical government agencies into a tailspin. To quote a former CDC employee, if you want to lose weight, you don't do it by cutting off your legs. Last week, approximately 1,300 CDC workers were fired. We do not know the exact number because DOGE hasn't provided the CDC a list of who it terminated. Managers found out that team members had been fired because they emailed them and got a bounce back saying the email address no longer exists. These Georgians were fired without any regard for their job performance and seemingly any regard for the critical nature of their work. Within minutes of being informed they had been terminated, their computer access was turned off with no opportunity to transfer files and information to their colleagues. Multi-year-long projects and data sets gone. Those who survived the first round of layoffs are terrified to speak out about what is going on in fear of retaliation. They are under immense pressure to voluntarily resign from their posts or risk being fired in the near future. And those who are abruptly terminated are trying to figure out how they will pay their mortgage or their rent, find a new job in their field, secure health care for themselves and for their families. They have gone from having stable careers to having their livelihoods turned upside down. The human toll of these haphazard mass layoffs cannot be understated, and the financial toll to Georgia families and the greater Georgia economy is still unfolding. And critically, there are public health consequences to DOGE's sledgehammer approach to the CDC as well. Public health consequences not only for Georgia, but for the entire country. So to delve into that point, I am pleased to have with me today several public health experts. Dr. John Besser is a PhD lab expert who will speak with you about some of the critical functions that the CDC carries out. Then, Dr. Katrina Kretzinger, who is an infectious disease expert, will talk about the serious health risks on our immediate horizon. And finally, Dr. Carlos Del Rio, the Chief of Medicine at Emory University and Professor of Epidemiology at Rollins School of Public Health, and the past president of the Infectious Diseases Society of America, will speak to the importance of the public health workforce. We will hear from Dr. Besser first.
Thank you, Representative Draper, and thank all of you for coming. Apparently love CDC as much as I do. So my name is John Besser, and I retired from CDC, where I worked for 10 years. But I spent 35 years in the field of health and public health, and I'd like to take my couple of minutes to tell you about what CDC means to me and to our nation and to the world. And for me, it wasn't just a job where I made a living. It was more of a mission. I got to get up every day and go to work for this very simple goal of making our world a safer and healthier place. And I could have gotten a job in the private sector for much higher pay, but I chose CDC because of the mission, like so many of my colleagues there. The work at CDC goes on quietly. Prevention is a quiet activity unless it's not there. My passion for CDC started long before I worked here. I was at the Minnesota Department of Health for 20 years. There we viewed CDC as the mothership. That's what we called it. And we turned to CDC for training, for leadership, for support, for experts. Whatever terrible public health crisis we were dealing with, there was somebody at CDC who was an expert on that. When we had young people dying mysteriously after routine knee surgery, CDC was there. When we had workers at a meat processing plant with sudden paralysis, CDC was there to help us. And outbreaks of polio, tuberculosis, botulism, Legionnaire's disease, hemolytic uremic syndrome in children, even cases of Ebola, CDC worked with us nights and weekends to make our state and the world a healthier place. We used to jokingly call ourselves the CDC of the North because we actually functioned much like CDC for the hospitals within our state. But this isn't a joke to countries around the world who have actually adopted versions of the name Centers for Disease Control. There's the China CDC, Taiwan, India, Nigeria, the Republic of Georgia, and even the European CDC. That's because this is the most respected public health institution in the world. When coming to CDC, I focused on foodborne disease. And you may not realize that CDC actually has no regulatory authority in the area of foodborne disease, but every single American, every Georgian benefits by this relatively small program at CDC, which is just one of many, many programs. One of the activities of CDC is to detect and investigate outbreaks, and this allows investigators to find previously unrecognized problems in the food supply, problems that can be fixed and that could make millions of people ill. Every major commodity you can think of has been improved for the rest of our lives because of these investigations. Poultry, beef, melons, leafy greens, tree nuts, stone fruit, flour, cheese, dairy, spices, ready-to-eat foods, all safer because of the activity of CDC and its state sponsors. You see this in the news all the time. You see about outbreaks of foodborne disease, salmonellosis, listeriosis. What you don't see is that there's between 30 and 60 investigations, multi-state, multinational investigations every single week. And most of them are quietly under the radar. But these change the economics of food production. It makes it cheaper to produce safe food than to produce unsafe food. It protects the food industry by creating a level playing field for those responsible producers. And it helps prevent collapse of entire commodities when there's a problem. When I go onto the CDC campus, I feel really grateful to have worked in a place where I can work and make a difference. And I feel really proud to be in the most respected public health institution in the world. Thank you.
Thank you so much, John, for your comments. And thank you for the invitation to speak today. In my talk, I'd just like to highlight some other health risks that are currently very real for Georgia and which will be amplified by reducing staff and funding to CDC. I'll be doing this by discussing two diseases, measles and influenza. Control of both of these diseases rely critically on data sharing and cooperation at many levels of government and with the international community. 70% of CDC funds go to support state and local public health, where disease information, surveillance data are actually collected. CDC staff work very closely with state and local colleagues to analyze trends across states. CDC also supports global partners. In the past, CDC has supported a global network of more than 700 measles labs. These labs determine what strains are circulating. In addition, detection and control of flu relies heavily on the funding and expertise of CDC's laboratories and networks. So I'd like to pivot to measles now. That's a disease which is especially dangerous in infants and in people with weak immune systems. Measles is not just a rash. It can cause blindness and deafness, pneumonia, brain infections, and even death. It is estimated that in 2023, more than 100,000 people died of measles. Furthermore, 1 in 5 persons with measles needs to be hospitalized. Measles is one of the most contagious diseases known to humans, and it spreads very, very rapidly. Vaccination rates need to be very high to keep measles from spreading. Luckily, we have an extremely effective and safe vaccine. This vaccine has been used for more than 50 years and has saved more than 90 million lives globally. But it works only if people actually receive it. The rate of vaccination in Georgia is too low to fully protect the spread of measles. In order to contain measles and to protect children, we need to investigate outbreaks, do lab testing and typing, and to analyze the data to understand the risks and to prevent the ongoing spread of disease. Most measles cases in the United States spread from Americans who travel overseas and who return infected. More than 50 countries currently have large outbreaks. Cooperating closely with the international community is critical for measles control. Both travelers and public health workers need to know about the places where there's a risk for measles. You may be aware that there's currently a measles outbreak in western Texas, with 58 confirmed cases to date, doubling in just this past week. The cases are in people who are unvaccinated or who have unknown vaccination status, and 13 have been hospitalized. Currently, the source of the infection in Texas is unknown. And there's also a risk for measles outbreaks in Georgia through international importation or spread from other cases in the United States. Measles outbreaks are costly, not only in terms of the health effects for the individual, but in terms of public health response, hospitalization, and the time spent caring for children and remaining isolated. They can cost up to $30,000 or even up to $80,000 per each case. The point I wanted to make here is that measles anywhere is a threat everywhere, and control of measles, detection, prevention depends critically on having a public health workforce, such as the one at CDC, to carefully monitor the trends and intervene in an appropriate and timely manner. But some of the staff that need to do the needed testing investigation have been let go at CDC. Funding to global partners has been slashed. Communication with critical global partners, such as WHO, is now blocked. Resources as simple as test kits for confirming measles cases are no longer available at reference laboratories around the world, and the reduced ability to detect outbreaks can and will affect Georgia and the United States. Consequently, at this point, we're driving blind. Without adequate resources to detect, prevent, and contain outbreaks, measles can spread and multiply in this state, in Georgia. And I just wanted to talk really briefly about influenza as well before I turn the floor to Dr. Del Rio. As you may know, this has been a really tough flu season. It's costing million, 37,000 and 19,000 instead of October this year. The flu vaccine doesn't always prevent infection, but it dramatically reduces the risk of hospitalization and death. But despite this, the administration has decided to terminate CDC's flu vaccination promotion campaign. More alarmingly, avian flu, or the bird flu, is circulating this year, mostly among poultry and among dairy cattle. There have been 70 confirmed human cases through transmission from animals, and the unsettling possibility that the virus will change in ways that make it easier to spread to people. We should be looking harder for this, but we are not. Many of the usual warnings and communications alert from CDC have gone dark or are delayed. So in conclusion, I would just like to say that beyond these two specific examples, it is really important to remember, as John just mentioned, that the impact of the preventive work that CDC does is invisible until it's not, and should not be taken for granted. Georgians do not live in fear from polio or smallpox. And as Dr. Besser explained, our food supply is closely monitored for safety. CDC staff work tirelessly to identify and control health risks. In conclusion, I just wanted to say that CDC's ability to protect the health of Americans will be critically compromised by funding and staff cuts. Thank you very much.
Thank you and good morning, everyone. As you heard before, my name is Carlos Del Rio. I'm an infectious disease physician and the past president of the Infectious Disease Society of America. I do not work at CDC, have never worked at CDC. So why do I care about CDC? Well, I think that for those of us that have Atlanta as our home, CDC is really personal, right? Many of the career employees of the agency are our friends, our neighbors, and our trusted colleagues. And as you heard before, CDC is home of some of the leading experts in public health, not only locally, but globally. When the world looks at what to do when a disease outbreak occurs, it frequently does not look at WHO, it looks at the CDC. And as you heard before, there's CDC in many other countries. There's a CDC Africa, there's a CDC in many countries around the world with the name CDC, in great part because it's a brand. CDC is a brand. It means something. It means excellence in public health. So why do I think of CDC as so critically important? Well, because the work that CDC does impacts all of us on a daily basis. You heard about it in food safety. You hear about it in a variety of different public health programs. But when public health is working at its best, as you heard from John, you don't see it. I think about public health a little bit like the fire department. When the fire codes are followed, when there's no fires, everything is fine. But when there's a fire, you want to have the fire department there. And when there's an outbreak, you want to have the CDC there. And we're facing multiple outbreaks, measles, bird flu, influenza. There's an outbreak of Marburg in the DRC. There's an outbreak of Mpox in Clade 1 in Congo. So I could go on and on. So whatever happens globally, we have to remember it's a plane away from us. It's a plane away from this country. And here in Atlanta, yes, good news is we have one of the busiest airports in the world. Yes, it also means that everybody from anywhere around the world can potentially be here with a transmissible agent. So what's the importance of CDC? CDC is there to protect the health of Americans. And they do it on a daily basis, working tirelessly. I remember back in 2011, during the bioterrorism attacks, friends and colleagues at CDC were not working 8 to 5. They were working 24 hours a day trying to figure out what was going on. They were working 24 hours a day to prevent what was really causing enormous panic in the population of what was going on with, first it was anthrax, then people worried about smallpox, then people worried about something else. And the CDC people worked tirelessly, not only to detect and figure out what the outbreak was, but also to stop it and to prevent it from happening. Now, the fourth thing that CDC does, and I want to talk about, is training. CDC is there to train the next generation of public health leaders. And many people have been trained at CDC and have gone on to public health, not only here in the state of Georgia, but throughout the nation. So the nation public health workforce, in great part, really depends on what I would call CDC University. And that CDC University, one of its flagship programs is what's called the Epidemic Intelligence Service. It's training that next generation of public health leaders who then go on, they're training what to do, just like a surgeon gets trained on how to do surgeries. The EIS officers get trained on how to do outbreak investigations, how to apply public health. But they also have training in laboratory science, and they also have other trainings. And in fact, the CDC training is so respected that around the world, there's programs called the FETP, the Field Epidemiology Training Programs, that many countries have implemented using CDC as a model to replicate globally. So this is something that if you stop the training of the next generation, you essentially are preventing future people from getting employed in the field of public health. And believe me, when there's an outbreak, you want public health experts who are highly trained and ready to respond. It's not like you can train them overnight. It requires multiple years of training, expertise, and development in order to get to that. So the training that CDC does, so a lot of the people that were let go were in their first year, were recently employed. Many of them were there for their training. So when you let go, it's like, if we said in a university, well, everybody that was brand new is going to let go. Well, a lot of them are going to be the brand new students, right? They just started. That's not a very good idea when you think about the importance of training in developing the next generation. So I just want to end by saying, first of all, that I have deep respect, not only for what CDC does, but respect and admiration for the CDC employees and what they have contributed to the health of our nation. And I just hope that they will continue to do the same in the years to come. Thank you very much.
Thank you, Dr. Del Rio, and thank you to all the presenters. I hope the point that we are making to the public is crystal clear. These layoffs will not just affect federal workers, the ripple effect is going to hit all of us. And if it's not a public health crisis, I have to ask, are you okay with the DOGE approach being used when it comes to air travel safety? With the agency that secures our national stockpile of nuclear weapons? Yesterday, the New York Times reported drastic layoffs planned for the federal office that funds recovery from natural disasters like Hurricane Helene. These cuts could slow down the distribution of recovery money to rural Georgians. What more has to go wrong, or who specifically has to be harmed, for our leaders here in Georgia to wake up and demand a stop to the chaos? Because the reality is, I can speak from this podium all day long, but that's not likely to make a difference with Donald Trump and Elon Musk. On the other hand, there are statewide leaders here in Georgia, like the governor, like the lieutenant governor, who have direct lines of communication and personal relationships with the current administration. What we are asking them to do is put partisanship aside, put politics aside, and maybe even set their fears aside, and stand up and speak out for the Georgians that need their support right now. Demand an end to the indiscriminate layoffs, call for the reversal of the layoffs that have already happened, and if there is a desire to streamline government, insist that it is done in a way that is respectful to the critical functions of these agencies and that treats Georgians with the dignity that they deserve. Thank you. So at this time, I'd like to open it up to any questions from the press of myself or our speakers. Okay, so the question is, why has it been so difficult to determine how many layoffs there have been, and is there a dollar figure for the impact of these layoffs? And I'll start, and if anybody wants to come in, they can too. So we touched on this a little bit. These layoffs are so haphazard. There's no strategy. There's no lists. We literally do not know who has been laid off because DOGE has not let the CDC know who has been laid off. Again, people are emailing their fellow employees, their colleagues, and they're getting back return emails saying this email does not exist. So it is a symptom of the chaos that is DOGE. To me, that is the opposite of government efficiency. It's government destruction. As far as a number figure, I think that is still being felt, right? There is such an interrelation between the CDC and the funding cuts and the grants that are given to other health departments locally here in Georgia. So as grants are being cut off to the CDC and being cut off to universities, they're being cut off downstream. That's certainly going to have an impact with the services that these grants provide. It's going to have an impact on the people who are hired, the contractors who are hired. So we are still feeling the effect, and they are going to continue to amplify. Does anybody have anything to add? So the question is, have there been any conversations with the leaders of this state about what is going on here in Georgia? I am unaware at this time of any conversations that have been gone on. The only public, so I'll just say, from my friends on the other side of the aisle, the silence has been deafening. I mean, what we need in this moment in time, as things are getting more extreme, is a coalition of people from all parties, from all parts of the state, to come together and say, no, this is enough. Because right now it's impacting folks in Atlanta at the CDC, but it is going to hit other people. I gave the example of the office that is giving recovery aid to parts of rural Georgia. So it is going to affect other parts of Georgia, and we need people, the leaders of this state, who have asked the people of Georgia to trust them with leadership, to stand up and say something. Now, as far as the governor, the only thing I have heard him say on this issue is that sometimes government can do a little bit of right-sizing. And I would submit to you that is as callous as it is wrong. There is nothing right about the lack of strategy with which these layoffs are being done and the dysfunction that it is causing. So I would like to see something different from our governor and a recognition that these are Georgians who depend on him for his leadership, and we're going to ask that he give us that leadership now. The question is, could they accomplish something by speaking out? I would say, what is happening if everybody is silent, right? We have seen throughout history when people remain silent, the oppressors are allowed to win. So again, we have to have a coalition of people that band together, that stand up, that say they're going to be brave. And absolutely, with this administration, there is a risk of retaliation, right? I think that is why people are being silent. But we certainly have a bunch of people here in this building who are running for higher office, that want to run to represent Georgia statewide. I think this is an opportunity for them to lead in protecting Georgians. Okay, so which critical functions have been affected and what expertise has been lost? Do one of my friends here want to address that question, who might have more knowledge?
I think the cuts have been across the board because they've been haphazard, as Representative Draper said. So I think at this point, since we don't know exactly where the cuts happened, we couldn't say what functions. I do know of one. You've all heard about the disease detectives, and they were reinstated because of the public outcry. But there's a laboratory version of that called LLS. They're young, bright people from around the country who serve much the same function. And the first year of that class is gone. So I can tell you the next generation will be in trouble.
I'm sorry, I can't hear you. Is that in the Senate? Yes. Okay, so I haven't read that piece of legislation yet. What I will say is I don't think anybody here is against the idea of efficiency in government, right? There's absolutely a way to approach this that is thoughtful, that is strategic, that audits what is happening, that gets to know what these incredible, brilliant employees are actually doing on a day-to-day basis, what services they provide the public, and how can we make it more efficient. I just want to be very clear that is not what is going on with DOGE. So to answer your question, if there's an attempt to do that at the state level that is thoughtful and strategic, I would certainly be in favor for that. But very clearly, that is not what is happening at the CDC. I mean, maybe they will, maybe they won't, but look, I said this to Patricia the other day. In this state, if there had been a manufacturing plant that opened up and gave 1,300 jobs, the governor would have issued a press release. He would have come down to the Capitol and talked about it in the state of the state. We would be celebrating 1,300 new jobs coming to Georgia. But 1,300 jobs are lost overnight for indiscriminate reasons, and there's silence or there's acceptance. That's unacceptable. So, you know, our unemployment rate is very important. The economy is very important here in Georgia, and whether these people are able to get jobs right away or not is immaterial. I also want to say, look, the folks that are in these jobs are in this for the love of the mission. It is for the love of public health, right? And I am so grateful to them that they have that passion, because the work they do is incredibly important. So I just think that's an immaterial point. Yeah. The bird flu, H1N1, but would one of you like to speak to that?
You know, you can make predictions. You cannot make predictions. The reality is, as I said, public health is like having your fire department, right? It's almost like you're asking me, well, do you know where a fire is going to come next? You really don't. But it's important to have, in order to keep people healthy, you need to have a strong public health. You heard about things that are happening right now, but other things could happen. I mean, on a continuous basis, when we saw a COVID emerge, nobody was predicting that. So I think one of the things that public health does, and is getting probably technical, is something called surveillance. It's continuously looking at what's happening. And one of the things that happened as a result of COVID is something called wastewater surveillance. So actually they collect basically poop, you know, from around the nation in different toilets. They take that and then they analyze it in laboratories, and then they're able to say, well, it looks like this thing is going up here or that thing is going up there. A lot of that data, a lot of that surveillance is then centralized by CDC, analyzed, and then that's translated into actions in public health. So it's hard to know what's going to happen next, but what we know for sure is that always something is happening. Always something is the microbial world is continuously in a, I would say there's a almost like this continuous fight between us and microbes, right? We are sharing an environment, and as things happen, as we invade certain environments, as something happens, as we eat certain foods, we have travel, the environment has changed dramatically. Used to be that in 1918, when the famous Spanish flu outbreak occurred, it required several months for people to come on a ship and come to this country and bring it. Nowadays, you can get on a plane today in anywhere in Africa, and within 24 hours you're here in this country. So again, you really don't know what's going to happen, but you need to have that line of defense to be ready at all times.
America was worried about the cost of eggs. Just wait till there's a salmonella outbreak with eggs, right? Yep. Yeah, so there's a comment about what Representative McCormick said yesterday. with respect to CDC jobs being replaced by AI. I would just echo the response that he got from his own constituents. Did you have something to add?
I use AI a lot, and I'm very fond of it. I can't think of a single job at CDC that would be replaced by AI. I can think of a lot of jobs where it would be a help, but I don't know of any jobs that can be replaced by it.
Right, well, thank you everyone for being here. Thank you for every one of you for being here. You are heroes. Thank you. Thank you.